This is Dr. Kavanagh by Associates of South Texas. I'm going to show you a different technique to remove the nucleus. This is a technique popularized by Paul Koch of Rhode Island. It's called stop and chop. It's a variation of divide and conquer. Uh, this is a useful technique in either hard or soft cataracts. It requires making a central trench where the nucleus is divided into two pieces. You can see here we're going to make our normal main incision with 2.8 millimeters with a steel keratome, and our side port incision has already been made superiorly. We're injecting viscoelastic into the anterior chamber to keep space. We're going to use a capsulorhexis forceps to make a approximately 5 millimeter capsulorhexis. This will capture the 6 millimeter optic of our silicone lens 360 degrees, and you can see here we make this usually in 2 to 3 grabs of the capsulorhexis. The next step of stop and chop or any nuclear disassembly is usually to proceed with hydrodissection. That's injecting balanced salt solution underneath the anterior capsule, getting cortical cleaving hydrodissection, and to rotate the nucleus and make sure it's freely mobile inside the capsular bag. As you can see here, we're going to use our phacoemulsification handpiece to divide the nucleus in two pieces. We have a elongated Sinskey hook as our second instrument. This is the type originally described by Dr. Koch. And you can see here we're sculpting a central trench in this soft nucleus. It is important to sculpt a deep and long trench so as to be able to crack the nucleus into two pieces. And you can see here the nucleus easily divides into two halves. Next, we're going to turn the nucleus 90 degrees. The heminucleus have been freed, and we're going to embed the phacoemulsification handpiece in the first half of the nucleus, and we're going to crack it into two pieces using a quick chop or vertical chop method originally described by Dr. Vladimir Pfeiffer. And you can see here that we are removing the first piece very easily of the nucleus. Then the second piece follows very easily. We're going to turn the second heminucleus 180 degrees so it faces the phacoemulsification tip, and again we're going to try to crack this piece into two further pieces into quadrants, and we're going to suck those quadrants up into the phacoemulsification handpiece. And you can see the nucleus disassembly happens very quickly, probably in less than a minute, and we're going to then show removal of the cortical material using a silicone tipped INA. That's irrigation aspiration handpiece, which is like the phacoemulsification handpiece except without energy to break up the nucleus. The silicone tipped irrigation aspiration handpiece has several advantages, being more capsule friendly and the ability to strip cortex therefore centrally to peripherally. We're here going to show you the usual removal technique from peripheral to central stripping of the cortex. As you can see, after we remove the bulk of the cortex, there's still this strandy, wispy cortical material left on the posterior capsule, and we're going to show you our power washing technique here using a 27 gauge blunt cannula to dissect all this cortical material off the posterior capsule. And you can see this is a task that would be very difficult using even a silicone tipped irrigation aspiration in the cap vac setting, but we can see this cortical material has been pushed off the posterior capsule centrally. This is where the patients have their obviously day one visual acuities measured through, and the clearer this is, the better their vision is day one. We're going to inject in a silicone 3-piece Li61AO Bausch & Lomb lens, and you can see it easily goes into the capsular bag. And you can see that we're going to remove some of these little wisps of cortical material that are now free off the posterior capsule. We will finish with stromal hydration of the wounds, and this As you can see, shows a clear capsule, well-centered lens. Thank you for your attention. This is Dr. Kavanagh of Eye Associates of South Texas.